So now we'll move on the assessment of the peripheral vascular system. Before we start with the assessment, let me first interview the patient. Good day, sir. I am Nurse Cover from Our Lady of Fatima University, and today we will be assessing your peripheral vascular system, or the PVS. So before we start with the assessment, let me first interview you po. So, do you Okay, for the current symptoms po, have you seen any skin changes po like color, temperature, or texture?
Wala naman.
Okay. Meron po ba tayong leg pain, heaviness, or aching?
Wala po.
Um, Meron po ba tayong mga leg pains na nagpo-bulge?
Wala naman po.
Meron po ba tayong nararamdaman na leg sores or open wounds?
Wala rin.
Nagsaswell po ba yung legs or feet?
Hindi po.
Do you have swollen glands po or nodules?
Wala po.
Okay. So, for the past history po, meron po ba tayong previous problems with circulation in arms or legs?
Wala naman po.
Meron tayong heart or blood vessel surgeries or treatment? Okay. So, next sa family history. Meron po ba tayong family history ng varicose veins, diabetes, hypertension, coronary heart disease, elevated cholesterol, or triglyceride levels?
Wala po.
Okay. Sa lifestyle and health practices po, naninigarilyo po ba? Like drugs, trabaho? Okay. Nagre-regular exercise po?
Opo.
Meron po ba tayong peripheral vascular problems that interfere with the activity of daily living?
Wala po.
Meron po ba tayong ginagamit na medications to improve yung circulation or control ng blood pressure?
Wala po.
Nag-use po ba tayo ng support hose?
Hindi po.
Okay. So now that we're done with the interview, let us now proceed on the assessment of the patient. Before we start with the assessment of the patient, I would first sanitize my hands. So now, I'm gonna inspect bilaterally for size, presence of edema, and venous patterning. I would also inspect for the skin color, and I would also inspect the client's fingertip for clubbing. So, sir, can you please do this? So, on the assessment of the bilateral, for size, presence of edema and venous patterning, I didn't see any discoloration on the skin. I didn't see presence of edema and venous patterning. For the skin color, it is also normal, and for the clubbing, I didn't see any clubbing on the fingertips. Now let's move on to determining the capillary refill time of the patient.
So now by pressing on the nails on both hands, I am now checking for capillary refills. I noticed that the fingernail of the patient is pink, which is normal, and the color returns to normal within 2 seconds or less than 2 seconds. When it takes more than 2 seconds to return, it indicates peripheral perfusion and reflex cardiac output.
So now I'm gonna palpate the radial ulnar and radial pulse of the patient. So the pulses are normal and
So the pulses are regulars and the rate is within normal limits.
Now that we're done on the upper extremities of the patient, we will now move on the assessment of the legs.
So now that we're done assessing the upper extremities, now we're going to the lower extremities. Now I will be looking for the color of your skin, which is appropriate for your ethnicity. I'm also looking for the hair distribution, and the reason for that is when there's poor circulation, sometimes there's no hair on the lower extremities anymore. Now I'm looking or inspecting for the annual lesions or ulcers as well as for edema. And I see that my client's feet are free of lesions and ulcerations, and also there are no presence of swelling. I'm also gonna touch the lower extremities for temperature bilaterally. I will use the dorsal part of my hand all the way down to the toes. So upon checking, the patient's toes, feet, and legs are equally warm bilaterally.
So now I'm gonna assess the, now I would palpate for the popliteal, dorsalis pedis, and posterior tibial pulses. So for the posterior, for the dorsalis pedis,
Now, the way you find this pulse, there's a couple different methods. You can start between the first and the second toe and move straight up. The patient has nice, strong pulses bilaterally, so they're easy to find. For many elderly patients, it's very difficult to find their fetal pulses, and sometimes it's not so helpful, in which case you would get a Doppler ultrasound instead. So here I'm checking the posterior tibial pulse. This pulse is hard to find, so you might have to move your fingers around a little bit. So don't forget to check both of the feet at the same time. The pulse is normal and the rhythm is regular. So that's it for the assessment on the peripheral vascular system. Thank you for participating in this assessment.